Good evening and welcome to the June 2026 Health, Social, Educational, and Environmental Committee meeting. What am I doing? Okay, I'm going to ask Legislator Admisio to say the pledge. Pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
I will ask Mary to call the roll, please.
Legislator Admisio.
Present.
Legislator Russo.
Present.
Chairwoman Montgomery.
Present. And now the acceptance of the minutes. We don't need to vote on that, do we? No. Okay. And now we will have an update on the status of the ARPA funds. Actually, I'm going to give you a little report first. I forgot that. I'm going to do a chairwoman's report this month because we had a very extensive meeting in May regarding food insecurity. And I just wanted to give you a brief update in my chairwoman's report. I'm copying our chairman, Birmingham, here, which I think is a great idea. It might save time to get us out of here to get to the Nick game. So following the May 13th Health Committee meeting, where we heard from many stakeholders regarding food insecurity in Putnam County, my initial takeaway from that meeting was that the county should consider establishing a food security task force. However, in follow-up conversations after the meeting, I learned that a substantial amount of work has already been underway through the Putnam County Food System Coalition. Exists, so which was established several years ago by the Cornell Cooperative Extension. So I also just had a conversation with Marissa O'Leary at Putnam CAP, and she shared additional information regarding the coalition, which currently includes representatives from Putnam CAP, Second Chance Foods, United Way, Glenwood, Ryder Farm, and the Putnam County Health Department. So according to Putnam CAP, the coalition has conducted food access mapping, community surveys, and they have coordinated efforts to strengthen food distribution throughout the county. So more importantly, the coalition's work has helped lay the foundation for the grant that supported the Meals on Main initiative, which is the reason why we started having these conversations. So based on what I learned, I believe it makes more sense to build upon what exists rather than to try to start a new task force. And with that, in particular, I think there's value in bringing just additional stakeholders into the conversation, including food pantries, emergency food providers, the Office of Senior Resources, and, you know, to talk about the initial $150,000 that we allocated in the 2026 budget, rather than us deciding as a legislature. My hope is that this coalition will convene and give us some ideas about what should happen. We heard at the May 13th meeting that some of the things that we're in most need of were cold storage. The idea would be to distribute 3 cold storage units throughout the county. Maybe that $150,000 could go there. I know when we initially set up that fund, it was because we wanted funding for food pantries in our particular districts. So maybe that's what will come out of this coalition, but I look forward to continuing the conversation, and I welcome any additional information regarding Meals on Main, as well as thoughts on how OSR can participate, and Office of Mental Health, Office of the Health Department, and we obviously need to add the local food pantries to that, and probably the regional food bank. So I'm looking forward to that. I think I was going to originally withdraw number 5, but I think we need to discuss this some more. So with that, that's my report, and we'll move on to number 5, which is an update on the status of ARPA funds Excuse me? For the ARPA funds? Okay, I want to give just an update on what we did last night in regard to passing the resolution that we did last night, and then if okay. I mean, what's the reason for the executive session? I need, well, if I'm going to, excuse me, I'm the chair. If we're going to call an executive session, I need to have a reason that's within the.
I withdraw my request for executive session.
Okay. If I feel like we're getting into, well, contract is, or if I feel like we're getting into personnel issues or discussing a contract. Okay. All right. So maybe you can call out if I'm getting close to saying something that would require an executive session. That'd be great. Thank you. Thank you. So number 5 is an update in the status of the ARPA funds appropriated for mental health and the contract with People USA, which is already public, and we've already, and the 2.1 mental health fund. So just an update. It was originally listed as an update. The reason that I was going to change it is because the status of the contract were addressed last night, and we did address it at the Rules Committee meeting. The resolution was revised, and the budgetary reallocation moved forward now that the legislature has received the fully executed cancellation for convenience signed and dated June 8th, 2026. I didn't feel like it was necessary to bring the administration in for that. And there was still some question about where is this $2.1 million that was apparently allocated for mental health, and nobody ever saw that in the budget. But we did receive late notice today that there actually is a line item in the budget. You all got this in your email late in the day. So now that $2.1 million is actually assigned to mental health. That's great news. The only outstanding item, I believe, is the letter of necessity. And I feel that needs to be updated because the original letter of necessity reflects an April 20th date of cancellation for convenience. And I believe, to make the record straight, it needs to reflect the actual date when the contract was canceled for convenience with People USA. Okay. Okay, great. So with that, I'm so happy. I don't have anything further. And I thank you. And I just, my intention was to exhaust every possibility to keep that funding in mental health. And we did that. And my other mission was to make sure the county's covered. And when we were discussing funds that were allocated and contracted with a provider, and we were discussing using it for something else, I was very nervous. So I'm glad that. Yeah. But we'll open it up. Thank you. Do you still feel the need to go into executive session? Okay, great. So now I'd like to open it up to the committee to see if they have any comments.
Well, I would like to just say that I'm really glad to receive that today, to see that that is allocated, the 2.1 million for mental health, because that was a concern of mine. And, County Executive Kevin Byrne did state that he wanted to do that and allocate it for that. And he had a press release regarding that, and I did send him a memo. So I'm glad that's all in order right now.
Great, I am too. I agree, and I'm glad that we can move on, and we hope that Treasury does approve that funding for paving. I would say that if we were going to have 2.1 for ARPA approved funding for mental health, and we had money at the amount of 2.1 in our budget for mental health, let's just give 4.2 million to mental health because it's needed. Sorry, Legislator Russo.
That's it. I'm just happy it's resolved.
Great. Anybody from the committee? Any legislator?
Just a quick little echo of what Legislator Adnizio was saying and the chair. And to dovetail about the last item last night that I spoke of, part of you'll be seeing forthcoming, all of you, a proposal from me with respect to the assigning of fund balance. how I'd like to see us reassume the delegated powers that we gave to the Commissioner of Finance in 2008, so that anytime fund balance is assigned, it'll have to be done in the public, in our forum, by us, in a public way, so that, again, I'm glad the county executive did that to assign it, and we now have proof of that. But if it's something we reassume a power unto ourselves, it can only be done in public for as far as assigning fund balance, so there wouldn't be any question as to whether or not it was. So little plug for my resolution in a couple of weeks.
Thank you
Thank you.
for that. I'll be looking forward to that. Legislator Regan.
Thank you, Chairwoman. Just want to call into question procedurally what transpired here today, and it's happened now a couple of times for those of us who are employed during the day. Memos that get sent out an hour or two before this meeting provide no opportunity for somebody like myself an opportunity to review. I work hard at reviewing all the documentation that is sent to me, provided for me, printed ahead of time, but emails and memos that are sent out within 2 hours of a legislative meeting, I have no opportunity to read. I can't read and drive. So I want my colleagues to maybe consider that process going forward. It seems to happen on a regular occasion when important memos get sent out right before a meeting, and I haven't had any opportunity to read it or consider what was written. Thank you.
Just to comment on that, these were memos sent from the county executive, and I agree. I felt coming into this meeting ill-prepared and not having all the information I usually like to prepare for ahead of time. So with these additional items being sent to us at 4:17, when I got a text message from my colleague saying we got it at 4:17, I assumed we got it in April, and I was really behind. So yeah, I agree. Sorry. Anyone else from the legislature want to make a comment? I think the lesson learned is, we heard verbally that things were canceled, contracts were canceled. We heard that there was a unassigned fund balance assigned to the amount of $2.1 million, but we didn't have proof. So I think the lesson learned for me is I love having these conversations, but I really need to see the document, and I need to see the canceled document, and so that's the lesson learned. Anybody from the public want to comment on that update? Okay. Number 6 on, yes, sir. Hi, how are you? Please come up to the podium, and if you don't mind, state your name. We don't have to ask where they live, do we? No.
Good evening, everyone.
Good evening.
Thank you for all your attention and hard work. Appreciate that. So with regard to this issue, it's very confusing as to where things stand. I know you've been involved in this, I think, obviously for quite some time, just based upon some of the documents that were just posted. But I'm not sure that the public really has an understanding of what you're talking about. I know I don't, and would greatly appreciate it if you would describe what was canceled, whether that is completely off the table, whether there's other issues that might resurrect that. But if you can give really further background, that'd be great.
I think I can. We've been at this for so long. I might even be able to give a brief synopsis for Legislator Regan's benefit. In 2022, we contracted with our ARPA funding that we were allocated, $19 million, $2.5 million of that $19 million we allocated for the purpose of mental health and opening a stabilization center in Putnam County. We found a provider, and I'm going to look at the commissioner to make sure I'm right here. We sent an RFP out, and we chose a provider for that stabilization center. That provider went to work in establishing that center in Carmel. They had to go through the process of the planning board. It didn't pass review from the Carmel planning board, so it failed. So we couldn't open a stabilization center. We knew that we still had that money contracted with that provider, People USA. And we learned in January that the stabilization center failed. And now we've got this $2.1 million now because they had to spend all that money in the review process. So we have to recoup their money that they spent. Yes, Legislator Crowley.
Not to interrupt.
That's okay.
Actually, there were 2 locations. We tried Brewster first.
Right, but
Brewster shut it down first, so we did go to a secondary. I just didn't want to leave that out, like we didn't keep.
sure. Yeah.
Thank you.
but in January, when we learned, and there was still a whole year left to figure out how to keep this money in mental health because the money had to be spent by December 31st, 2026. Still contracted with People USA. The county administration, the county executive announced that they were going to take that money and use it for infrastructure paving purposes. I, being chair of the health committee now, said, no, you're not. This is money allocated for mental health. We're going to do whatever we can to keep this in mental health. So we spent months talking to People USA. I actually wrote out a new RFP to see if we can issue a new RFP to keep it in stabilization services instead of a stabilization center. And none of it was possible. There wasn't time. There wasn't interest. There wasn't interest in issuing a new RFP. Once I realized there was no interest, I couldn't get an RFP through, we said, all right, we've exhausted every possibility to keep it in mental health. And last night, we rewrote the resolution to say now that, okay, we also didn't have a canceled contract with People USA. From January through June 8th, 2026, we were told that the contract with People USA was canceled in April. It was not. It was still an active contract. So we learned yesterday that it was finally signed properly, and I felt comfortable moving forward and reallocating that funds because we exhausted every possibility to put it in mental health. And in the meantime, the county executive promised to take $2.1 million out of the unassigned fund balance, not attached to ARPA funding, free of any ARPA regulations. And he said, we'll take 2.1 out of the general fund and put it toward mental health.
I
We-
just want to say on the record that I disagree with quite a lot of what you said.
Okay,
So just put it on the record that the law department disagrees.
okay. Do you want to clarify?
I think we're at the point now that we've kind of, we're past all that, but the contract was canceled. I mean, we've had so many conversations about this.
Yeah.
There's been numerous representatives from the law department that have argued this. Also in executive session. For your benefit, we did our best to allocate the funds to mental health. I mean, it wasn't like we squandered the funds on purpose.
That wasn't my
Well, I mean,
question.
that's what it seems to be the premise of what she's
Well,
saying.
it is the premise because in
Yeah.
January, it was announced that the funds would be used for paving.
There was no location, Nancy.
Right, but there was time for a new RFP to be
Right, so you
issued.
put a new RFP. Did you find the location?
No, it could have been,
Chairwoman?
excuse me one second. It could have been an RFP for stabilization services. It didn't have to be a center. Any of our numerous providers, People USA could have provided services. Well, if a new RFP was issued and we had responses to a new RFP to provide stabilization services, we could have contracted, and it would have been pretty easy to spend $2.1 million between January of 2026 and December of 2026, almost a whole year. There's mobile unit cars that could have been purchased. There could have been plenty of
There's legality issues that we could never do that. We cannot have mobile cars providing those services.
we
Madam
could.
Chair,
People USA actually provides that service.
Madam Chair, as a member of the committee, I'd like to make a point of order.
Sure.
I'd like to ask that anybody wishing to speak, whether they be a legislator, whether they be a member of the administration, whether they be a member of the public, to kindly ask for recognition from the chair prior to speaking.
Thank you. Okay, so we're getting into the weeds with this. Basically, there was $2.1 million left tied to ARPA funding allocated for public health up until it's still allocated for public health, actually. That's the way it shows up on the Treasury registry. It's allocated for public health. We can't find a place for a stabilization center. Nobody was interested in issuing a new RFP except for me. And we've exhausted every possibility for that to be kept in mental health. And now we've reallocated it to see if Treasury will allow us to use it for paving. In addition, we have money that's not assigned to ARPA that has been allocated $2.1 million to mental health. What that's specifically going to be used for, we will be updated in the future by our Commissioner of Social Services.
So just to clarify, the contract with People USA has been canceled.
Correct.
And I had heard, we'll call it rumors because it's very difficult to know anything outside of this group, but that there were explorations of expansion of services in Garrison. And so I just wanted to confirm that that is not something that this group or the legislature or the executive is pursuing.
I would totally pursue mental health funding for services in Garrison if the Commissioner of Mental Health has a program and a service that can be used for.
Right, I'm just confirming that there was I had heard a proposal specifically in Garrison and Phillipsbrook that was
There was never a formal proposal. What exists in Garrison, there is an existing respite house run by People USA. It houses 7 people, and it's a stabilization service called the Rose House, operated by People USA. That house, unfortunately, is on the market, and one of the options I suggested with a new RFP could have been to provide the funding for People USA to purchase the Rose House, to keep that one service that we have there.
So I could just say again, with the understanding of public is so limited, especially in that particular area, the understanding of what was there was not understood until I'd say today or a short time where there was this information that they were actually operating something.
They've been operating
Fair.
for 10 years legally.
Well, the question about that is this service, any service about zoning, so understand it is a zoned residential area that only has one use of single family housing. There's a question about, and that is also something in place for decades. So understanding that there was for certain uses, whatever the use happens to be this, but any use inconsistent is certainly something that is important for everyone to understand and what that means in terms of what uses can be and what they can't be.
So, and I'm sorry, I don't have the term at the top of my head right now, and if there's any lawyer or maybe the commissioner knows. So there is a zoning provision that makes, Pat, thank you. The Padavan laws, which is a zoning provision that provides for the legal use of that Phillipsbrook Road house, 111 Phillipsbrook Road, to be used for what it's been used for the past 10 years.
Well, I guess that's wouldn't be in a position to take a position as to whether some licensed facility is licensed and what licenses they have, what it covers, what someone can do, what they can't do, and whether
Is there a problem with the house as it exists on Phillipsbrook Road in the past 10 years that you've had?
Well, the issue is whether it's zoned in a certain way.
That you would have to take up with your building inspector and the zoning at the town. And we went through this for an hour and a half on May 13th, and unfortunately, there was some really degrading comments made about People USA and the Rose House, and it was way off base.
Well,
They legally operated, and they're covered by the Padavan laws. I suggest that if you are concerned about the use there that has existed for 10 years legally and rightfully, that you should go to the building inspector in the town of Phillipstown. And
that is a legal conclusion that you're making at this moment, and I'd be hesitant to make such a legal conclusion like this. But what I would say,
very confidently, I know.
Well, I can
it
say
operates legally,
equally
and if
confidently
if
that
you want
it takes a lot.
Write to me and question that, I'm happy to provide you with the legal documents if you'd like that. But I don't want to continue this conversation anymore.
Yeah,
okay?
my question really what was the status, because no one really understood.
The
what
Rose
status
House
was.
still exists. It's still operating. Unfortunately, the house is for sale, and unfortunately, we in Putnam County are gonna. I'm sorry.
No, I'm just saying that has nothing to do with that.
That has nothing to do with us. Unfortunately, my intention as the chair of the health committee was to retain that service for the people of Putnam County, and unfortunately, we're gonna lose it because it's for sale. So they'll have to find a new location in some other residential neighborhood where they will be illegally allowed to set up shop there and covered by the Padavan laws.
And I can just say, obviously mental health is a critically important issue, and part of any use is really trying to find the proper place for something, and whether a residential area which is zoned in a certain way is the right place. Really, the public does not really understand at all what what's the name? Public USA?
People USA.
People USA. What People USA does, who they are, how they operate, what precautions, what anything about it. There's just generally not much known. Now this body
Well, I
may,
think that's
but out there you don't.
It's the nature of it, and unfortunately, what happened on May 13th, we don't want to target on their back. Like, I used to manage and operate group homes for the developmentally disabled. We would go into residential communities, get licensed, covered by the Padavan laws, and open a house for 10 people with developmental mental disabilities. So it's the same kind of thing, and it's legal. And if there's a problem with things that are happening at the Rose House, I mean, I'm certainly more than happy to take those complaints and direct you in the proper agency to address it. But
It's not an issue of complaint. It's really trying to get an understanding.
okay, you know
of what they even do
have
there.
A long agenda,
We have no
and
idea
I
what they do
appreciate your
there
comments and your
and what it
concern, and
is.
I'd be happy to share the Padavan laws, and I can actually connect you with the People USA attorney, so she can help you.
Again, I'm not looking to have a questioning of an
Okay.
attorney.
It
But
would
I
be-
am my legislature to have an understanding of what is understood to be going on there. So I'm happy to have the conversation to learn about it and
They have a
reach out
great
to you. Happy
website
to have the conversation.
that tells you what goes on there. They explains all the services. It explains what goes on there. It's a peer-to-peer program. I can't get into what the program's about. That's not on our agenda. I would really like to move on, if I
Okay.
may. Thank you.
I appreciate that. I'm interested in having further conversations, more than a website. If this body has a better understanding of what
Okay,
goes on
we
there,
have
would
our
be great.
Commissioner of Social Services
Thank you.
here. Okay, great. Thank you. Okay, so now we're moving on to item number 6, which is a update on the co-responder team program. This is just an informational oversight item. There's no budgetary amendment or fiscal action before the committee tonight. The purpose is to understand the status of the CRT program as the current federal grant approaches its June 30th, 2026 expiration, and to understand what the county's plan is for behavioral health crisis response going forward. The sheriff's correspondence indicates that the sheriff's office intends to conclude its participation in the current CRT model upon expiration of the federal grant on June 30th. And the concerns raised included the staffing impacts, the overtime and the backfill, the program governance, and the need for a more sustainable model. So before we begin, I just want to be clear that the goal is to just get an update, not assign blame. I know we had some intense conversations about what's going to happen with the resources once this grant ends, who's it going to go to, mental health, sheriff's department, and, it's been some time since the May 13th, and I just would like an update on the status of the CRT program.
I went first last time.
Okay. And for the public's purpose, before us, we have the Commissioner of Social Services, Sarah Servadio, and our Sheriff, Brian Hess. Take it away.
And I also have Paul, our mental health director, too, because we're both tasked with trying to figure out a different approach moving forward. So I think that together with Sheriff Hess and the other police agencies, we will have a plan on crisis management moving forward within the next few weeks. But our CRT is
Say it.
Dissolving.
The mental health worker has moved into the mental health building on campus. That decision was made after the deputy that we were notified that the deputy would have been reassigned, but would be available to the mental health worker if needed and if available. So we pulled her into new space in building 3. So she's working with law enforcement right now as needed and responding to calls from community members, from family members, from our providers, and walk-ins to the DSS building as well.
Okay. Do you want to add to that, Sheriff Hess, before we move on to the committee?
No, I think the commissioner explained it properly. We did reassign the deputy. I have other tasks for him to do. He is available if needed. As you requested last time, the Jeep that they were using has been depoliced and waiting to get transferred over to DSS so they could use that vehicle as they need it.
You didn't know that?
Yeah, it's sitting out there. I was waiting for John Tolley has the vehicle, so as soon as he transfers it over, we should be set with that. And I'm waiting to see if there's a plan or proposal on moving forward and what the sheriff's office's role would be in that.
I do have a couple of questions, but I've said enough, so I'll open it up to the committee.
I'm good.
Okay.
I'm good for now.
Legislator Crowley?
Thank you, Chairwoman. So I have a couple questions regarding this. So with the deputy, I understand you broke it down a lot for us. And I know that you have a CAD system, and I know the Julata system was supposed to be implemented in DSS back in 2024. Am I correct? So what system are you allowed to say this? What system or how were you tracking? Because not everything that the sheriff's department was tracking was being tracked through the sheriff as the worker was being tracked, because she may go out on, to check back up on somebody, welfare check. And I don't know, I know in the sheriff's department, they use different codes. Correct me if I'm wrong, Sheriff, right? For domestic violence, welfare, person in crisis. Are those all things that are put in your CAD system when you're responding? And
Call types, yep.
yeah, so all of those are tracked, and then you guys also track other things on top of those, correct? Where it may not be the same numbers as the sheriff's department where you guys would have it. Does that make sense? Like you're for the person that was doing this job, maybe going out on a welfare check, and it's not being tracked in the CAD system because they don't have access to the CAD system. What were they using and how are they tracking the times?
The worker had access to the CAD system under their name. They don't anymore, but they did throughout the grant.
They did have access to the CAD system. Okay, is that true, Sheriff?
I believe so, yes.
Okay, I'm just making sure. I just want to dot all my I's and cross all my T's. So if that person was putting in something in the CAD system that didn't line up with, let's say, one of your call codes, I'm not speaking police, I'm sorry, but how would they log that in the CAD system? And if they couldn't be logged in the CAD system, how was it logged?
The deputy.
I think it was CRT follow-up
Yeah.
was the call type they were using.
So they would use that. So every call on both sides was always logged, even with mental health being protected, because I know there was conversation way back when a lot of these things were supposed to be kept confidential. So a lot of these calls were not necessarily logged, they were kept somewhere else, correct?
No, they were logged as CRT initial or follow-up.
But not in the CAD system.
That would be a law enforcement question. I don't know. We didn't enter as much information into the CAD, if anything.
So I guess that's the crux of my question is.
Their purpose, the mental health purpose was able to search and.
So there was some sort of programming, and did you ever look at your numbers? Because I know the sheriff came in with his numbers and he had a great spreadsheet and everything. Did you line them up with his to see what the difference was?
No, I have numbers, but they have not been lined up with this.
Okay. Because I think to me, I've gotten a lot of calls from different people, hospitals, schools, different things that they're upset about this. I understand that person will be on call. I want to that person went to school. There were two deputies at one point assigned to this, correct, Sheriff? To
It
this.
was only one deputy at a time, maybe two.
No, two
altogether.
altogether throughout the whole process.
Correct.
And they went to school. So they also they had training that was paid for and things like that. So is it now that only this deputy will be responding to these types of calls, or will be first car will be responding without the same training?
Right. It'll be the same as 98% of the other calls.
Okay.
There'll be a deputy responding, and then assisted by the mental health worker is what we're hoping for, is kind of what I think we see roughly now, right? She's responding to police calls from DSS instead of being in the sheriff's office.
Okay. I'm just asking questions because I want to understand to the tracking of it, because I know there's, like I said, the confidential aspect of it too, where I don't think it was put in the CAD system. I think it was logged completely different from what I understand. And moving forward, I think that there should be some continuity in tracking so everybody has the same information and can access it and pull the numbers so that they match, if that makes sense.
Yeah.
What happened with this program in 2024?
So we are in the process of vetting several different electronic health companies, record companies right now for a different project, that when we come back to talk to you about what our plan is for Putnam County, it will include exactly that, and it will include the possibility and the ability for all law enforcement and our emergency services to have access to the same portal that we will, specific to calls for service involving someone in crisis.
Okay, so then the numbers should line up and it will make sense, because I think it makes sense for everybody to understand, people recognize certain people in the community, and I just want what's safest and best for the county. And I would like to see something move forward. I understand the numbers and fiscal, I guess, comprehensive side that the sheriff talked about, but I also like the program too, so there's that. So to me, it means a lot, but I just want to see it move forward in some way. I'm glad that Legislator Montgomery put it on here tonight and that we keep talking about it. And, right now, that was our only mental health really that we had for, again, I'm going to bring up adolescents, but that's really what we had. And it's something that we need to have. And I just think we need to continue to work together to bring some sort of plan.
I would say
forward.
you still have it though, right? The mental health worker is still there. She's still available to you. The difference is right now you don't have the deputy, but you still have a mental health worker. So I just don't want to make sure we realize she's still there.
No, I understand she is. I just think there's I do think that there's an important part of having a deputy there, because sometimes, I'm not saying all the time, hear me out, hear me out.
You say that, it's my eyes.
No, I am looking at your eyes. I understand you have a budget to oversee, and I'm not gonna, your numbers spoke loud, and I just know that there wasn't a program where they were logging their stuff in the same way. So I just want to make sure that's available. I know I brought up about the mobile response years back when we had the iPads that fell through. That didn't work. We need to come up with something that's going to work. And, when you have younger kids, the mental health worker is there, but sometimes a deputy is needed to calm a person down, or, if it's somebody who is a little bit,
Hey, I'm going to cut you off.
stop?
Okay. Yeah. Does any other legislator have a comment? Anybody, you guys want to say anything else
Thank
about
you.
this program?
Can I just?
Sure, please.
So I thank you guys for coming in last month and explaining everything. The numbers were very realistic for both sides. Mental health is super important, and I understand the resources on the sheriff's side to redo the program or come up with another solution. Right now, is that person, that person's salary still being paid for by the grant, even though they've moved different building and stuff like that?
No, we made that transfer, remember? So we should have it till the end of the year. Since you approved that last approval we did, we paid for the rest of the Jeep, and we pay for the rest of her salary through January. So we should be good until 2027.
Okay. So she's being paid for.
Okay, good. See, took care of you.
Would have been helpful information to have. Sure.
Gonna make
We
no
need to talk a little more,
Well,
friends.
we were here. We all did.
Yeah,
this
we
was
did.
this is what started all the problems,
But-
right? Was that resolution to do the budget transfer that you remember? We were going to have a meeting down in my office. I was sick, but that was to pay for the remainder of the mental health worker salary through January, and to pay for the remainder of the Jeep to pay that off, so it didn't fall onto the taxpayer.
Okay.
So that's what brought us here for the first place. So this should not be any new surprise information.
But I'm going to just interject and say my hope eventually as we move on and find alternative models, which I think that's what we're considering here, and we're going to,
We're open to any proposal anyone suggests to us.
but we're going to force this conversation internally, and we're going to come here maybe every month and talk about what's the update on the alternative model. Is it, as we talked about, a mobile crisis, which we could have funded through that ARPA funding if we sent an RFP out, just saying.
So if
Sorry.
I could just make a comment about that. I think
Sure.
that, we're not yet ready to talk publicly about
I understand that.
just because I'm meeting next week with the two police chiefs and with one of Sheriff Hess's command staff members to discuss that. And we'll have an update for you soon.
That's great. I'll look forward to that, and we'll include the sheriff in on that conversation. And
The sheriff delegates it down.
Yeah.
So the
Okay.
captain could handle it. She'll report back to me and let me know
Great.
what the discussion is.
and my hope is we can have that stuff worked out maybe before we even get here, and we'll just keep those conversations going. I know how it works. Hybrid models, embedded. It sounds like what we have now is the clinician-led response instead of the
But the
law
sheriff's office is
enforcement.
here for her, anyone
Yeah.
who needs it.
Okay.
I do need to follow up though on the salary being extended
Yeah.
via the grant until the end of the year because I'm gonna question that.
Okay.
I don't.
Yeah, we could look at the budget transfer that happened. I don't have it in front of me,
Yeah.
but we can definitely please look
Because
into
we-
it. That's what I was explaining.
What I'm
today.
going to be looking for, and the committee and the legislators will be looking for, I'm sorry, I don't, is, okay, this is funded through the end of the year. This is an important program. We just saw, we lost some ARPA funding for mental health. We're putting in money for mental health. What are we looking at in the future? What's our 5-year plan, let's say? Let's come up with a 5-year plan to see how much money we will need with this unimaginable fund balance that we have. How much can we invest into mental health with services that are going to be lost probably in Garrison because they're going to sell the house? We're going to need to make up for these lost services at some point. And I don't want to look at the CRT as a lost service. I want to look at it as something we're reinventing and coming up with some kind of alternative model because possibly this model didn't work. Legislator Ednesio.
Just to say, so now you were saying you need some time, but do you think for this budget process coming up this year, October, that you will have some more information and we'll be able to move forward and, because I'd like to see it go into the budget, of course, yeah, okay. Okay.
As we said last year, we're
Mhm.
happy to fund a deputy position if that's what's needed.
Mhm.
I have I think it's a weird question, but
Uh-oh.
it's something,
great.
talking about
Put your seatbelt on.
Take by the next.
an impossible question, but we talked about those deputies being trained and they were sent, that's what the grant paid for. Is there something we can look to in the future where every deputy is trained? I know we have the mental health first aid, which I have, and I would recommend every citizen and every legislator getting that mental health first aid. And we have our own commissioner who does train our schools to do that. Do we see a future where deputies will get more and more mental health training, like the training they got for this
They
grant?
have I'm sure the commissioner will back me up. I think they have the very basic crisis intervention training. I think over 90% of patrol has that already.
Yeah.
Because you have to remember, we do this all the time, right? We talked about the 6,200 calls last year
Yep.
are mainly handled by law enforcement. So none of this is new to us, right? This is what we do. Would it be nice to have some advanced training? Sure. That'd be great if there's something more advanced that we could send people to, but there's a cost that's also involved with
Right.
that, right? Because There is no additional. So any of that training would be on overtime,
Mhm.
course cost and backfill overtime cost.
I'd be happy to look at that and support that for you.
I would just need
Yeah.
the commissioner to tell me what she thinks we would need.
Sure. And you guys are going to talk about that internally
Sure,
and
we would love
come
to.
here. I'm sorry, Legislator Reagan, you've been waiting for such
Thank you,
a
Chairman.
long time.
No,
How's that?
not at all. Thank you so much. 2 points I'd like to share and communicate is that, unfortunately, I think it's commonly known that there's some level of mental health interaction on almost every call that first responders do. Could be communicating the loss of a loved one. It could be different things, all different things that are dealt with. So there is a predominance of mental health in varying degrees in almost any interaction with the first responder community here in Putnam. And despite all of our stated good intentions that mental health is important, we want to do this right, we also seem to fret that we're at this particular position. So I'd like to point out, make note of the fact that there are small and big municipalities around us with infinite funding. And as best I can tell, nobody has perfected a model. Nobody has perfected a model. This is a continuing argument in almost every municipality around us. So while we keep saying the nice words, right, and we're lamenting the situation we're in here, it's not unique. We're not unique here in Putnam. We're struggling with this just like every other city and county is around us. So if there is another program or another municipality that has something that works that we can point to, great. But I don't think that we should lament so much where we are or belabor it because nobody else seems to have gotten it right. We're not deficient is the point I'd like to share. Thank you, Chairwoman.
Thank you. And I think the only thing we can rely on is the data. And for example, when we were in our most major crisis with the drug overdose issues in the late 2015-14, when the Rose House opened in Garrison, we saw with those resources that were being provided, and we woke up and the data went down. The number of overdose deaths went down, and we can see that with some of the things we do get right. And I just don't want to lose track of that, and I want to keep supporting. And another big issue for me is knowing how the deputies respond to these incidents. They do a fantastic job of things they're not necessarily trained for. They have to see the most horrific things, and I just want to make sure they're protected and have the training they need.
Understood.
It's not just all about us, the citizens, it's protecting them too.
I think, I'm sorry.
No, go ahead.
Sheriff, for the budget, I think you should put the cost in for the advanced training. Yeah, no, I would definitely agree on that. That's definitely, and also, the training will help also with any type of encounters that they have for them actually emotionally. So it's not just them helping other people, it's for them also to get the help because you see some sad things. So I definitely be in favor of seeing that move forward.
Just ask, we're here.
My office can put the same request in.
Yes, absolutely. I think that's important.
Did you have anything, Legislator Russo?
I just wanted to confirm for the public and as well as everybody here, the program is still an ongoing program. It's just not going to have grant funding. There's some money there somewhere, and it's just going to be tweaked a little bit.
No, it is not it is not a best practice co-responder model when there's a revolving deputy or a team that is not a two-person team ongoing. So we will figure it out and we will come back and talk to you about that. But it is not an existing co-responder team at this time, as per my standards and as per the best standards that we follow. Sheriff Hess might think differently of that, but that's on our end, it is not a co-responder team.
Thank you.
And I'll leave you with, if you need help, call 911. We will send somebody to help you.
Thank you.
Just a brief question, and it belies my ignorance on this matter, so I apologize. Does the badged person, I won't call it law enforcement, but does the person that goes out with the DSS worker have to have arrest powers and civil, like the power of authority, or is it more of a security? And again, this is probably a very basic question. I do apologize for the basic of it. Can it be somebody, is it a security position, or is it somebody who has, you need somebody who has the power to arrest?
It's a little bit of both.
Okay, so
There are
the answer is yes to the
there
arrest.
are-
You need,
yes,
okay,
there are
okay, that
different
answers my
models
question.
Named other things.
Yeah,
That
and-
allow for things like that.
Okay, so it's more than just and I'm not downplaying anybody's role. It's more than a security aspect to it for the
Yes.
person going, okay, good, I understand now. Or I think I understand part of it. You guys know a lot more than I do, but thank you for educating me, certainly. Thank you.
Okay, thank you for coming together. There's no motion, but I think I will say that we may request an update on this monthly.
Do you
Maybe.
have 2 minutes to speak?
Sure. I got protected next.
Thank you.
Thank you.
Next, we have item number 7, which is an update from the Department of Health on the Community Health Improvement Plan, the CHIP plan, from Supervising Public Health Educator, Shanna Siegal. And thank you. I have additional here. I'd like to make a motion to accept the additional.
Second.
Thank you. That's just an updated version of what you previously received because it was sent very early. So we sent it 2.5 weeks ago and we've done work in between.
Thank you. All in favor?
Aye.
We also have our Director of Health, Ran Rodriguez.
Good evening.
Good evening. Thank you. I'm not going to say anything. Take it away.
Sure. Well, we have a fun-packed, filled agenda this evening. So, I guess I don't want to keep us too long, but with that, you've already introduced Shanna Siegal, our Supervising Public Health Educator, and she's going to be walking you through our Community Health Improvement Plan priorities and where we currently stand in terms of our CHIP and CHOP process. So, with that, please, Shanna.
Thanks, Ryan. Okay, so you'll see, I think it's only 6 or 7 slides. And when we were here and we talked through the data from our community health assessment, we kind of outlined for you the plan that we would be headed out into the community. And you can go to the next slide. Thank you, Mary. That is Mary, right?
Yes.
Okay, hi. It's like I don't see people until I'm here. So what you see here is kind of where we've been over the last few months. We went to every town board meeting in Putnam County, and we went to some Rotary meetings. We had staff go to meet with our seniors at all of our friendship centers. We attended a few community events for kind of specialized populations to ensure that we got input from families who have somebody with disabilities in their home, folks who are primarily Spanish speaking, and our pregnant and parenting populations. And then we got key stakeholder and internal, Department of Health input on all of the data that was shared here, and tried to identify themes from all of those conversations to say, like, what matters most to people. So if we can go to the next page, you'll see here that the same themes came up in every setting that we were in, just in a slightly different order in terms of rank. So this is, taking all of that information together. You can see that what consistently came up from all of our communities across the board was healthcare access, economic stability, mental health and suicide prevention, and food access. And then the other 3 areas that were also part of our focus areas that we presented, where we saw that Putnam County was doing worse over time and we had areas that we needed to address, were kind of lower ranked for most of the community and stakeholders that we saw. Of course, we in public health, we believe all of this is important, but we want to ensure that when we develop a comprehensive community health improvement plan, I say comprehensive because what we send to the state are 3 items, 3 priorities. That to me is not comprehensive, but the work that we do year round is comprehensive. So we take this input very much seriously in our program planning internally, and then also continue to share that externally. So what we did when we kind of saw these themes appear was we went back to what the state provides to us, which is called the New York State Prevention Agenda. And we've talked about that before. You can find it online. I did link to it or put the where you can find it here on the bottom of this page. If you go to the next page, the Community Health Improvement Plan priorities. So this is the one that was mostly updated, and then the page after this was added in. There are domains that the New York State Prevention Agenda lists, and those areas that I just reviewed fell under these 3 domains essentially. So economic stability is the domain that houses not only economic stability itself, but also food access and healthy eating. So how does Putnam County look when we're looking at our poverty indicators, and then how do we look when it comes to food access? Healthy eating actually does live under social and community context, but just for ease of communication, we're putting them together for the purpose of this conversation. Healthcare access and quality, what shows up there is an area that we focus on in public health all of the time. And so I'll talk about what intervention we're going to be doing in that area. And then in social and community context, that's where, all of the mental health issues are placed on the prevention agenda. So if you go to the next page, this is a screenshot of, you can't really see it well on this, but if you go to the New York State Prevention Agenda, they have a dashboard that's interactive. And what we do in my division at the health department is we'll look at the prevention agenda, and we'll look at areas that have already been identified on that dashboard as areas where we either are not meeting the New York State kind of goals, or where we're performing worse over time. So what you can see here is just a snapshot of a few of the areas where we either don't meet what the state kind of goal is, or where we have been worsening over time. And so we know this data already, so I'm not going to go over it with you, but that's where we were kind of coming back to, well, if the community cares about the data that we have already shared with them as where we are not performing well, let's take that and look at what interventions we either already do in that area where we can strengthen the intervention, or where we need to do a new intervention. So you can go to the next page from here. And that is, I think, our last one. And I'll just kind of go through these. And then if you have thoughts or questions, we're very, open to continuing to hear from the community. We're in the end phase of this process where the CHIP is actually due to the state on June 30th. So that's why we really wanted to make sure this information was shared prior to that. And Rian has heard me say this before. This is the first full cycle that Rian is public health director, but, and sorry to anybody at the state who ends up hearing this, it's very important to me that we get this to the state on time and that it meets all of their requirements. But what is more important to me is that the work that we're doing to address community health improvement in Putnam County is work that the community wants and that the community needs, and that we can communicate that well, right? And so all of the things that you've talked about already tonight are things that are going to be addressed in Putnam County one way or another, and some of them show up here. So you'll see addressing mental health, you'll see addressing food security as some areas where we really want to focus and work. So the things that come up here in no particular order are implementing learning opportunities for mental health training and trauma-informed practices. So Rian and I did have a meeting with the Commissioner of Social Services and Mental Health, as well as the Director of the Office for Senior Resources, to talk through kind of the intersection of all of this work. And because of the co-occurring system of care coalition that is run through the Office of the Department of Mental Health in Putnam County, the health department is deeply involved in co-occurring work throughout the county. So this is an area where we feel like we can really make it more meaningful, more robust. It's already very effective. The COSAC, the committee, has already reached many people throughout the county with adult mental health training and youth mental health first aid training, and it came up here tonight. So there's probably not a day that goes by in my professional world where we're not talking about this. So we're looking at this through the lens of where else and how else can we support this? So at the health department, there are ways where we can have more trainers trained so that we have backup for the folks at mental health who are doing it. I'm a backup, but I'm frequently pulled in other directions. So I'd love for my staff to be trained to back up as well. Sarah knows about this. We want to support just making sure that there are adequate trainers. We can support also connecting with communities where maybe this is not implemented. And so rather than talk about that publicly here, we want to go first to some of those more vulnerable communities to gauge need and interest, and then we can share that. I'm going to save the vaccination related ones for the end because that's specific to the health department, but other areas where we intersect are working with what they call the Office for Aging, but that's our Office for Senior Resources, to look at the services that are already available. And specifically what we talked about with Sarah and Marlena was, how are we reaching older residents in Putnam County who don't attend our friendship centers? And that's not a new question. But we did, all of us together, come up with some kind of innovative ideas and ways where we can get creative with some funding that we do have to make sure that resources are available to people who don't currently access the resources. So you don't have to use our senior center in order to find out about programs that are available to you. So we're kind of looking more carefully in ways to coordinate that. That does have to do with food access. It also has to do with social care networks and kind of bringing in the provider networks as well as health insurance carriers to the table to address some of these needs. We have a really wonderful resource guide that has been compiled. Putnam CAP leads a community resource group, and we have people from county agencies that participate in that group, and annually they update the resource guide. It's on our county website. It also is on Putnam CAP's website I think for the first time it's been translated into Spanish completely. So we've been talking about ideas and ways to maybe take that resource guide and that concept and, again, make it more accessible to people, because it's a really big guide and you don't know it exists if you don't know it exists. So trying to help get that out. And then more robust collaboration with the Department of Social Services. Specifically, we talked about, we already participate in community outreach together in many community events, but the cross-training of staff. So an example would be, health educators from the health department are out at many community events that maybe other government and local government departments are not always at. And so it'd be really helpful for my staff to be trained on child care subsidies and things that DSS deals with all of the time, so that we can help to identify and refer and make that warm handoff more appropriately, because we meet a lot of members of the community who aren't going to self-identify as somebody in need of services. But we should be trained to be able to connect people to care. What is not fully listed on here, we did talk about food access, but I was waiting till I had more information, and I have a little more information today, not a lot that I can share, but with some of the partners that Legislator Montgomery had referred to earlier when talking about food security in the county. We know that there's a partner who's received some funding, and we were getting creative with them on the phone this afternoon to try to see if in not just our chip that we hand over to the state, but in the work that we do together, we can look at where the money is. And many of you know this because I've said it here before, that we have a lot of money in dual settlement funds. And so I haven't even gotten to tell Rian this. But we're, the collaboration is so important that when we get to have these conversations and we can get creative, I get excited about it. So, I'm excited about the prospect of kind of braiding together the messages and the opportunity to connect people to nutritious food sources. But if we integrate smoking and vaping cessation or education or prevention or risk reduction into what we're doing with those folks that we're connecting to food sources, we can use dual settlement money to do that, right? So the primary impact to me would be that people are introduced to accessible ways to live a healthier life. And we could use money according to the AG standards, because we would be addressing smoking or vaping, but we'd be connecting them to nutritious food or diet planning or meal planning or whatever it might be. So while we don't have firm interventions right now for you, within the next 20 days, we have to have them ironed out. But that was kind of this afternoon's development that I think are areas that are outside of the health department, but that we'll partner with and kind of build up will definitely be in mental health for sure. And will be likely in food access. If not food access, it will be in economic stability, which would be focused on our entire population. But the state does require us to have a disparity that's addressed. And for the state, that disparity would be in 65 and over, which is where that collaboration that I mentioned earlier comes in. The last piece that is a little bit more straightforward, right in our lane in public health, is addressing the steep drop-off that we shared through our community health assessment with HPV vaccination rates. And that comes up actually in our next agenda item, where we're talking about the funding that we created the resolution for. So I can get more into that next. But essentially, the health department is definitely going to work with provider offices and utilize our health education division as well to target the zip code, the areas where we saw that steep drop off in HPV vaccination rates, to help educate the community, educate providers, and see if we can, work to prevent cervical cancer primarily, but other cancers as well, through ensuring people have accurate information and access to the vaccine.
Thank you.
How did I do? Was that too long?
No.
Okay.
It's a lot of information. Yes.
Yeah.
A lot of really, really great information. Yeah, so now we go to implementation, right? That's always the hard part.
Yeah, exactly. So, we have the state is very specific on how we select our priorities and objectives. What interventions we're doing have to be kind of like, maybe not approved by the state, but they're viewed by the state. And as I said, they do want us addressing disparities. So 2 of our 3 priorities have to address disparities. The HPV vaccination one, they don't include like geographic disparities in there. So our mental health intervention, as well as our either economic stability or food access, will address disparity.
I have a question
Mhm.
about the priorities and how they were chosen.
Yeah.
Wondering how they were chosen. I just want to make a comment. What I love about plans like this is that this is what we use when we go to the state or the federal government, and this is how they determine their budgets and what's going to be allocated for what. And I think it's so important. Data is really important to me in how I make my decisions. So I'm just wondering, with the priorities, did it come from data?
Yeah. So, well, I can't speak to at the state level how they chose the priorities that we have to basically select from, but way back when we were here presenting on our community health assessment, the 8 areas that we presented were essentially areas that we called focus areas, where we saw that Putnam was performing worse over time compared to ourselves, or we were performing worse than the state or the region, or where there was a noted disparity among a subpopulation in Putnam. So we took those, and that's what we went to the community with. And then once we went out to the stakeholders in the community and they came back with, we asked everybody to kind of rank. We went over the overview of the data and then asked everybody to rank it, who was either in the room or there were ways that they could do that virtually. And we did the overarching areas as the priority areas as they're listed in the prevention agenda. So we gave the narrow detail, but then we asked them to kind of just zoom out a little. So if mental health and suicide was like an area, right? And healthcare access was an area. We didn't specifically say like HPV vaccination, but alcohol and tobacco was an area because we saw that these were the places that we needed to focus the most.
Yeah, now I'm remembering attending some of those workshops at the Bureau, and I remember Legislator Sage there, and now I understand. It's interesting for me to see how it all comes together, and I think how ironic that 2 of these priorities, well, really all 3 of the unmet indicators were just discussed in this meeting. In fact, food security, mental health issues, suicide,
Yeah.
which is all. So
Yeah.
it's so interesting for me to see how this is all pieced together, and I really appreciate the work, and I'm going to open it up to the committee to see if they have any comments or questions.
No, just thank you for this comprehensive report this evening. There's a lot of information here, and great job.
Yeah, so thank you for all this information. It is a lot. I just have a couple questions. I took one of the mental health or health surveys online. Was that part of this data?
Yeah, so there was a long form one. So if you took that long one, thank you, and I'm sorry. We really try to like stay away from over surveying people. We don't want people to get survey fatigue, but we really wanted to make sure that people saw the data before they voted. Right? We wanted to avoid people just telling us what they thought was important without knowing how Putnam's doing in that area first. Even though we all kind of knew this stuff without the data, there were no real surprises. But yes, so that was one where basically in place of listening to me say it all, people had to kind of read or look at the graphic and then answer the question about it before they could rank.
All right, and then on your Let's Talk Health Community little spreadsheet, there's two sections that both have community events. Were those two separate events, and you only did two separate events?
Yeah, so we did.
The data's the same except for the top item.
Yes, you're right.
Top two.
I got to look back at my my master spreadsheet for that, but we did 3 community events, and for some reason, maybe I put 2 of them and not the third one there. We combined the 3 in our master, even though they were in 3 very different settings. So the 3 settings were the autism acceptance walk, where we had a table for families, and we did an event at Casa Servir, so it's a primarily Spanish-speaking congregation, so faith-based community, and then the community baby shower that was hosted by Maternal Infant Services Network. So just to kind of like make sure that we reach people that maybe weren't watching all their town board meetings or
And then my last question is, how did you present the questions to the different places you went? Was it a survey on a form?
Yeah, so basically everywhere except for those 3 events, they were very similar. Well, Live Healthy Putnam are our community partners, so that was a much deeper dive. But town boards, Rotaries, and Friendship Centers essentially had the same presentation that you all saw here. Those 3 community events had modified versions. So at the Autism Acceptance Walk, we had a lot of sensory bins out so that kids and other people could play in the sensory bins. And we had places for people to still vote, but our educators were there kind of just verbally interacting with people, trying to give overviews of everything. And Casa Servir had a little bit more of an in-depth presentation, but it was in Spanish. And at the community baby shower, it was also set up like a tabling event, but it was more like one-to-one conversations, much smaller event.
Perfect, thank you.
Thank you for the question.
Any legislators have any comments? Yes, Legislator Crowley.
Say thank you to Shanna. And again, Shanna, you never ever disappoint with your information and your knowledge, and you not only read it to us, but you give it to us visually to all of us.
Everybody learns differently.
Make it a little friendly to all the different kinds of learners. So thank you very much. I appreciate all the work you guys do over there, and just really thank you. Take pride in it.
Thank you.
Chairwoman?
Legislator Regan.
Thank you. Just a quick question, and I can kind of deduce here by the similarity in the answers in the 6 different events, the answers must have been provided, right?
Yeah.
And then prioritized?
There were like
So-
voting cards.
Yes.
at most
So
events.
asking both of you, including Director Rodriguez, do you see a variance between what the community wants and what the community needs? Do you see a variance between that?
Do you have a thought?
So I would say yes, which is why I thought this approach was very important. I think this was the first time that we really focused on creating a bidirectional conversation with the community. I think a lot of us, especially at the department, are sort of data nerds, right? So, we look at a lot of data, we infer from a lot of data. Oftentimes, that may not be what's actually seen and felt in the community. So we wanted to make sure that we created a process that got the community involved. And what you're seeing here is recognition of the fact that there is a quantitative process where we look at data, we source data, we talk about that data, but then there's the qualitative process that we open up to the community to say, is this what you're actually recognizing? Is this what's important to you? And then we have to also determine based on certain guide rails, and I think impact and feasibility were probably the two primary ones that we looked at, where we said, okay, where can we truly do something that is both impactful and feasible, right? So I think those were sort of the guiding kind of posts, if you know, you want to sort of look at it that way in terms of how we ensure that we created a conversation that not only informed via the data, but informed via the voices in the community.
Yeah, and I'll just add to that, thank you for bringing up impact and feasibility. That's like my favorite part of this whole process, is when we kind of have to go back and make those hard decisions. That Legislator Regan, to your point, I didn't see a huge divide between what we think is needed and what the community thinks. However, the greatest divide is in what we think we can address in public health and what the community needs. And, you know, this is where, like, addressing the determinants of health is such a huge part of public health, but it's not something that we are built to do. You know, that's always been something that's been in the hand of lawmakers. That's been something that's been in the hand of, you know, maybe businesses, business practices, economic disparity being, I think, or economic stability being, I think, the biggest concern and the biggest driver. And we know that the other factors that we can address, people don't have the capacity to care about right now. You know, talking to people about alcohol and tobacco is so low on their list when, you know, economic stability is high on their list. So yeah. So that was, I think that was a really good part about all of this for us, was that it does sort of validate that, like, we know that there are things that are out of our reach, but it's still our job to share that information so that other people can take action as well. Not just, you know, this doesn't just live in public health. This is for all of our well-being.
Great. Thank you both for answering that. Thank you, Chairwoman.
Thank you. Did you gather this data and by zip code or anything like that, where you can see one area needs something more than another?
Some of it is available on like a sub-county level by zip code, and some of it is not. So it really depends on the indicator you're looking at. Even just before, I was trying to pull up the Social Vulnerability Index and look at a few things to see when it was last updated, which was 2022, to see certain things by zip code. But yeah, so it kind of depends.
Thank you.
Thank you. Anybody from the public want to make a comment? Yes. Hi, come on up. Introduce yourself. And
Michael Strauss. I live in Putnam Valley. I was at the town board meeting that you gave your presentation. It was excellent. I asked the question then, and I'll ask it again. Have you an idea of the type of emerging threats that we are going to be facing in the future? We have wonderful documentation about the current threats, but are we trying to stay ahead of the curve in some way, shape, or form?
You want to go?
Sure. So I would say most definitely, and this is not somewhere where we work in a vacuum either. So, you know, there are some really good collaborative organizations that we work with where we specifically talk about emerging threats, right? And we are currently living in a world of hantavirus and Ebola and all kinds of new emerging kinds of issues. Screwworm has now made it to our shores, which hasn't been here in over 60 years, right? So there are constantly new emerging threats that we are discussing, that we are keeping on the radar, that are above and beyond sort of what's happening here in terms of this chip child process. You know, I'm not here to sort of scare anyone, obviously, but if anything, it's sort to belay the concerns, but that there are not only those at the department that are working very hard to make sure that we're sort of gauging what's going out there in a very scary public health world, but that we ensure that we have the appropriate skill sets necessary to be able to address those concerns if and when they become an issue. So,
Yes, and because Mr. Strauss did ask me this question publicly once before, and I'll share what I said there, just so that everybody hears it here as well. That what's not in the prevention agenda and what didn't flag for us right now, and just because of the way the prevention agenda is outlined, just as a reminder, this is a 6-year cycle we're looking at. We're not looking that far into the future, and so we're looking at recent indicators to see kind of local impact. But I did say in Putnam Valley that, environmental health is a big concern, and we know that. And so some of what, Rian is talking about in emerging issues is communicable disease, but we also do have these same partners that are working at the state and federal level, where we have ongoing conversation and plans, and there are pilots, that we've talked about and will be talked about in the future to address some of those environmental concerns. So I think tied together with what we know public health is typically in the spotlight for communicable disease, it will also there'll be a focus on environmental health, which is not something that you'll see in our chip right now.
Thank you.
I have another question. Forgive me, I forgot the full title, the CHR&R that's on your website. Apparently that's going to be sunsetted, and is there going to be something to replace it?
The rankings, yeah.
So it is unfortunate. I believe you're referring to the community health rankings that's put out by Robert Wood Johnson,
Yes,
which
yes.
is an excellent source. Unfortunately, it looks like it is being sunset. Right now, there isn't something that we're aware of that is going to replace that, which is obviously going to be quite a loss. But we are also looking at sort of what exists out there in terms of alternative information that could potentially be utilized. But we do share your concern. It was an excellent publication. It was one that we sort of utilized a lot as a source of information. I think, moving into the future, we're going to have to sort of see where we can develop or find additional sources to potentially replace that.
And for those who aren't familiar, you'll recall that when Putnam County is named like the healthiest county, that's where that came from, right? So it wasn't like us declaring it internally at the health department. It came from this county roadmaps and rankings that won't exist. But that is, correct me if I'm wrong, Rian, like secondary data that they collect, and so that that data still exists in many different places. The prevention agenda that I've spoken about in New York is not comprehensive, but if anybody is curious, the dashboard that has all of, a lot of data is going to be updated twice a year now. So that's kind of a new development that helps to offset kind of, the waiting around for another data source to present itself. It's not everything, but it's something.
Great. Thank you. I don't think a motion is needed for this item to approve it. You'll be sending this to the state, and if we
we'll have like a final version we will send to you, just as an FYI, and then it will go to the state on time.
Thank you for all the great questions and the information, and I think in the future we'll probably request a progress update. So with that, the next item on the agenda is item number 8, the approval budgetary amendment 26A049 from the Department of Health for New York State Association of Health Officials Immunization Action Plan Grant and Contract. The budget amendment increases estimated revenues by $25,000 and increases estimated appropriations by $25,000. There's no fiscal impact. But that was your line.
You've been taking my lines every meeting, so that's all right. Yeah, I think if you want to understand a little better, Shanna can explain it. It's just, Shanna, why don't you explain it?
Yeah, Shanna, there you go.
Okay. So this was a sort of rushed application, so thank you for considering this resolution after the fact due to timing. So NYSACHO is the New York State Association of County Health Officials, and they are they're essentially the advocacy body for local health departments statewide. And they also run the groups that Rian was talking about, Emerging Issues Committee and things like that. So they announced this, this funding opportunity, specifically an immunization action plan funding opportunity. And kind of at the same time, a few of the counties in the Mid-Hudson region had the same idea to like, well, it's only for $5,000. It would be a lot of work for each of us individually to go through our legislative process and get $5,000 for work. But what if we did it all together? And we know that the issues that exist in one county in the Mid-Hudson region exist everywhere. This group has worked together. 7 Mid-Hudson counties in the Mid-Hudson region work together the last 2 CHA and CHIP cycles to complete a Mid-Hudson community health assessment. So we have an active work group among mostly epidemiologists in all the counties, but also some other staff. So this group, 5 counties, got together and submitted this proposal to do a social media focused campaign to place kind of geo-targeted ads based on zip code in areas that have immunization disparities. So where there's an area where we know that there's a drop-off in vaccination rates that could impact public health, then we could target those messages specifically to that area at any given time. So for our portion in Putnam, we had kind of ventured to say, sorry, Bill, that we could take on being fiscal lead for this, and that would kind of give us a little bit more of the kind of control over the social media kind of planning and landscape for implementing the ads. Our division in health ed has like a very robust social media presence, and we felt like we could take that on. So we were awarded $25,000 for the 5 counties to it's essentially going to be meta ads. So we'll be placing meta ads, developing them together as a region. It's called the Hudson Valley Public Health Collaborative. It's not an organization. It's just all of us folks working in local health departments. But we would create a Facebook page. We've talked to Tom Lannon about this and kind of gotten his seal of approval on our proposed plan. So the Hudson Valley Public Health Collaborative being kind of less of a government entity and more of just public health experts. Yeah, it's a coalition kind of addressing this need. So each county can take the lead on, content development for the issues that are specific to them, but we'll all work together. So for us in Putnam, you heard me talk about the human papillomavirus. So that vaccine is an area that we definitely want to have targeted messaging. We can do that geo-targeting. It can be based on demographic information, so we can reach parents with accurate information. This is really about providing accurate information for people from a source they can trust, and allowing them to make the decisions that are best for them and their families. So HPV is an area, and also the flu vaccine is an area where we know that we will definitely be running our campaigns. Other counties will have a focus on measles because they have, right. And so if we needed to pull that campaign, we could pull and run that campaign locally too, but the money would initially be made available to counties in the areas that are outlined in the grant application, and areas where they know that they have, vaccine rates that are declining or are of major concern. And so that's a great way that our community health improvement plan, all of the interventions we talk about are not funded. So this is a great way to now we can fund one of our interventions from our community health improvement plan.
Impact and feasibility.
They're coming back.
Yeah. Okay. I don't have any questions. I think it's a great program. I'm really glad that you established this coalition and we took the lead, and nothing better than that. Any comments from the committee?
No, very good.
Nope.
Any legislators have any comments? Anybody from the public? Okay, I make the motion to approve the budgetary amendment 26A049. Can I have a second?
Second.
All in favor?
Aye.
Aye.
Thank you.
Thank you. Okay, the next item is number 9, approval budgetary amendment 26T139, Department of Health Deputy Director, position and reorganization plan. And we do have additional, thank you, Legislator Russo. We have additional for number 9, and basically the additional is the correspondence back and forth, requests by me, memos from me, asking for more clarification about the position. You know, we didn't have the specs for the position on our website at the time when this was first proposed, but now I see that we have it. There's also a memo from the state dating back, you know, giving the health department, you know, the go-ahead. They don't oversee this position as they do for our Director of Public Health. So it's not something they have a lot to comment on. And then we also have the memo from personnel and Patricia Rouse here too.
Motion.
So can I have, yeah, I was just explaining what the additional was. So that's all that's in the additional, and can I have a motion to accept it?
Motion to accept?
All in favor?
Aye.
Aye. I didn't get a second. Can you second?
Second.
Second, all in favor?
Aye.
Great. Aye.
I don't think Patty Rao
She
is here.
seconded it. Okay. So, oh, Adrian. Sorry, I said Patricia.
Oh.
Blame
Yeah.
Patty, she's not here.
That's crazy. Okay, so you know this is a transfer of $80,245, and it decreases appropriations from personnel services. Am I taking your wind? From the environmental health director, the fiscal impact is 0 for 2026 and 0 for 2027. And obviously, you know, we've been talking about this. It first came before us, the Personnel Committee, and I know you're anxious to see this through before we get into budgetary talks for 2027, because we did get a mandate to not create any new positions for 2027. So, but following my memorandum, we were provided with all the information asked in my first memo, and based on those materials, as I just said, they were provided with all the information we were looking for. The job spec also makes clear that this is not simply an administrative support position. It's a high-level professional managerial position. The Deputy Public Health Director would assist in the operation of the Department of Health. They would oversee support operational programmatic activities. They supervise subordinate staff and administrative or operational functions. Department of Health also advised that personnel, there are no Part 11 qualifications for deputy directors. Not every local health department across the state has this position. We had this discussion when we were deciding whether or not to go with a commissioner or health director. If anybody has any questions of that, I did, you know, all that research, so I can help you with that. So I'll get to my point. My concern tonight is no longer whether personnel approves this or the state. We're being asked to create and fund a deputy public health director position that may act for the public health director, but that position's not vetted by New York State Department of Health in the way the director is. So the proposed qualifications also allow for a candidate without a master's degree, provided they meet the bachelor's degree and experience requirements. So I want to be very clear. This is not directed at individuals considered for this position or the potential candidate. My responsibility as the chair is to make sure this legislature or this committee right now understands exactly what authority we are creating for this position, what qualifications are required, what oversight exists, and what position is being reduced or eliminated, which we already did that. So before I move forward with it, I'd like to hear the thoughts of my committee members to consider this, creating this position.
Well, I'd like to hear what they
Sure.
have to say regarding this.
Oh, okay. We
Right, we-
did
we
hear
just-
some of it in personnel, but
yeah.
we're happy to hear it again.
Sure. I would start by saying that I think one of the interesting things about this evening is that one of the more common themes has been really around new ways of doing things. And what we're really proposing here is to look at the department and really determine what is in the most optimal sort of structure that we can create for the current set of scenarios that the public health department is facing currently. And we just had a very good presentation in regards to what we'd like to be doing both strategically to address what's come out of the community health assessment. One of the things that gets recognized as part of that process is that there really needs to be continuity of operations. So although, as you've mentioned, not all the local health departments throughout the state have a deputy, I would suggest that if we look at what we've created here in the county as structure, all of our large departments do have some form of a deputy, whether it's the sheriff's department, DSS, DPW. I think there's a recognition of the fact that we need to have a seamless, coordinated command structure. And while I am happy to serve this community as long as I can, the reality is there was a lot of focus spent on my first year here to ensure succession. And that happened throughout all the divisions. We spent a significant amount of time and energy ensuring that we were creating not only upward mobility throughout the divisions, but that there was defined succession and really a philosophy of mentoring and recognizing mentees. Because one of the things I think is a formal charge of mine is to ensure that this department can be successful whether I'm here or not. So part of this evening's discussion, and I'd like to thank you for once again at least listening to this request, is that together we create a scenario in a department that can respond regardless of what the issue at hand may be. As sort of mentioned earlier, there is an internal candidate that we are attempting to get recognized in this position. I think that individual brings all the necessary skill sets to be able to function in this capacity. As you mentioned earlier, we did bring that person before the state just to make sure that they could be or they could serve in that position, I should say. And although, as you've mentioned, they really don't take a stance here, they did recognize the fact that this could happen as a conditional appointment. I do think that it is important to create a pipeline where we have someone that is both recognized, can function in this capacity, but is also looking to get the necessary credentials to eventually take over the position. I think what we're requesting here is really to ensure that we have a department that is fully functional all the time, regardless of who's at the helm, and ensuring that we have that pipeline and are nurturing both not only internal candidates, but additional candidates out there that may someday want to join the department as well.
Thank you for that.
Okay.
Appreciate it. One question I wrote down earlier was, this is, an $80,000 budgetary transfer. What would be the salary for this position overall? Is it the 80,000? 136. Okay.
That's a proration starting June 1st for 26.
Okay. So my other question / concern is, there are people that work in the health department that do have their master's degree, and I find it just an irregular way of a hiring process. I love internal process. I love the idea of bringing up somebody through the ranks in the internal process. That's great, but I'm concerned about morale in the department, where you do have people with their master's degree that work for the department who are not even being considered. I'm sorry, it's highly irregular to have the person sitting in the room while we're discussing this position as well. So this person's been chosen already. The position isn't even created yet, and this is no disrespect for the person that's been chosen. It's just a very irregular process. So, what does someone in the health department with their master's degree make?
Well, there's a huge variation, right? So we have someone who just completed their master's in public health who is a environmental health aide, right? And what does that individual?
Making 60.
Okay.
Right? And then you have the other side of the spectrum where our lead sanitarian is making
Oh, Lisa? What'd you say?
sanitarian, associate sanitarian.
Oh, you told me, yeah, it doesn't make 160.
160 or
Right.
6?
That's
So-
because of the
Longevity,
et
okay.
cetera, et cetera. Been
Gotcha.
here quite a while.
So that is a huge variance. And the reason for that is because a credential shouldn't be sufficient enough, right?
Correct.
Someone directly out of college who then just put in another 2 to 3 years, to finish their master's coursework, while I, completely advocate for continuing in higher education, I would say that person is probably not still suited in terms of their experience and background to be able to be a deputy. I took a significant amount of time last year assessing all the personnel there. And although there are a significant number of individuals there that have MPHs, none of them, other than the one being proposed, as far as I'm concerned, both had the runway, because that was part of my consideration, in that my expectation here is to fulfill my appointment, which is another 4.5 years, right? So runway in terms of length of other individuals' career paths was something that was considered, as well as skill set. So I think, although, respectfully, I understand your questioning in regards to having multiple staff there that are sufficiently credentialed. Quite frankly, they didn't have either the demeanor, full experience, because what I'm asking for is someone that can work interdepartmentally, so across all divisions. They may be an expert or subject matter expert in their particular division, but I would have to say the person being proposed is the one that I sought, that I felt really brought all of that to bear. Unfortunately, or not unfortunately, they just opted to seek a different kind of credentialing in the healthcare field, which I actually think is well suited for the position as well.
And I understand the skill set. Let me make it clear, there's no question about the skill set. This isn't about the person. It is an odd way to go about the hiring. I'm used to, a hiring process.
Right.
There's not really a process here, my concern. So, sure, Adrian, and I think you guys, this is relevant. If the committee's okay, if I hear from Adrian,
Of course.
sure.
Absolutely.
So, obviously, I'm Adrian, I'm Selling Acting Personnel Officer. One thing I did want to mention about the position.
Come on, if you don't mind going to that mic, if you don't mind.
Hello, can you hear me? Is that good? Okay, great. Is that it is a competitive position, which means that it would be a provisional appointment pending exam. So anybody that qualifies to take the exam could take the exam. So
I understand that.
it does kind of open up, the field.
I've been in local government for a really long time. I know how those provisional positions work and the test. And the hope is that they're on the list.
Right, but it's open to everyone that qualifies. So
thank you for that. I don't think I have any questions right now, but from the committee.
I have a question.
Sure.
What Adrian just mentioned. So you're saying it's a competitive exam. The exam will be given?
There's no exam.
No, but
yet.
why would it be given if the person's already placed in that position? So I'm not sure about that.
So this is a newly classified position. It is competitive, so an exam would be ordered. It would be a promotional exam, so any internal candidate that qualifies would be eligible to take the exam. So an appointment would be a provisional appointment pending exam.
Until the exam is taken.
Correct.
And, okay. So if there's more than one person and they have a higher,
Well, it's
Right, if they get-
one of the top three willing to
Right.
accept, right? But they're on an eligible list, and depending on what happens in the future, they'd be eligible.
okay,
for
thank you.
appointment.
Thank
Sure.
you for clarifying that. Rion, I know you keep saying to ensure your succession. Are you leaving in 4.5 years? Or sooner?
I mean, that is my current appointment.
Uh-huh.
You know, that takes me, quite frankly, to 60. At that point, I guess, you know,
still
we
young.
would see where things are at that point. But yeah, I mean, you know, it is certainly my expectation to, at minimum, fulfill my
Right.
appointment.
Okay, thank you.
Thank you.
Okay, sure.
Legislator Rousseau, anything?
No, your position's an appointed position? Correct. Right, thank you.
Thank you. And so this person is appointed by him as the director. Legislator Crowley.
So it's under minimum qualifications, it says master's degree or higher, or bachelor's degree in public nursing. The person that's being considered does have the nursing degree. The others do not, and has started their master's. Now, if there's no ladder for that person to go, let's say, go any further, and if you read further during succession plans, it says, you know, we strong to support succession planning, professional development candidates are strongly encouraged to enroll in a master's program. This person has already started a master's, maybe stopped it because there was no ladder. Maybe with this position, it would continue on for a master's, but it's either or, master's and or.
I understand that. Legislator Crowley, when this position was proposed, there was no job description, so there were no qualifications for this other than what I understood as a master's program. And in my opinion, if somebody is going to serve as the deputy health director, they should have all the qualifications that the director does, because they will be serving as the capacity of the director should something happen to the director.
Okay, I just wanted to point out
Okay.
what it said. That was it.
Yep.
I'm just.
And as you know, there was no job description provided. There wasn't one created. There wasn't one online.
You know, and you know what? I think that it's great that they have the succession plan in there to give somebody the, maybe the want or need to keep going in school to have a succession plan. I think that's wonderful. It inspires people.
So with that, can I ask, with the state's recommendations that a county public health director would serve as backup, why did we choose to allow the bachelor's degree to go into this job description and not a master's?
So my understanding, and we borrowed this job description from a similar county. So, you know, we were basically utilizing the verbiage that they had proposed.
Can I ask what county that is? So we can-
Tompkins, was it Tompkins, and for the
Why
other?
don't you leave then if
was
it's
Tompkins?
disgusting,
'Cause
Legislator
We wanted one
Crowley.
that was similar in terms of
Harris employees.
population size. You know, we got one from Westchester, but obviously that's going to be a bit more elaborate. So between those, you know, we kind of, you know, obviously with our colleagues in personnel, we're able to come up with what you have in front of you.
So I have to respond to Legislator Crowley's comments that are on the mic, that this is disgusting and I'm embarrassing employees. I'm not here to embarrass any employees. We just saw the skill set that this person has, and I appreciate her work very much. As I said, it's kind of highly irregular to have the person who's chosen for this before the job was even created. So that's uncomfortable. And so again, I'm doing my job as a legislator. I worked through COVID. You know, I had some concerns about our commissioner at that time not having the qualifications to be the commissioner and having promised to get the master's degree. And I know you said the state is going to do away with that recommendation, and we'll see that when it happens. But I lived through that. I lived through the promise of the master's degree. It never happened. That person has served the county really well. Would I choose that? I had this issue with the planning department. I would have preferred to have chosen a commissioner of planning with an actual planning degree. Years ago, we decided not to do that. Now we have a deputy planning commissioner who doesn't have a planning degree. So it's kind of across the board in the county, bringing that level of expertise and training and education down. And I don't want to do that. I've witnessed this, you know, a lot in the county. So what I'm concerned about is the job description, you know, kind of created after the fact too. So enough from me. We have any other legislators that want to comment? Anybody from the legislative floor that wants to comment?
I will, thank you.
Sure.
The Chairwoman. So I appreciate the fact that you're looking to the future for a succession plan. I am not stuck on any master's degree. I know I was never privy to any information of whose position this is, but I think we have some really talented individuals in our health department that are looking for job growth and have chosen Putnam County to further their career. And if they are willing to increase their knowledge to serve the people of Putnam County and use their talents here in Putnam County, I'm all for it. I'm also fully supportive of your ability as a director to staff your department in any way you see fit and to see for the future success of the Putnam County Department of Health. I think we have a great health department. I think your plan is valid. And I think the success of this department is your greatest, your greatest willingness, greatest achievement and what you're looking to do for the future. So I think this is, I'm not stuck on education of master's degree. Our previous commissioner of health had a degree in medicine and had accomplished quite a bit in his education and career. Although it didn't match the standards of the Albany politicians that they tell you what to do, he had a greater education in my mind. And I think someone with a master's degree, I think maybe isn't the best fit sometimes. But I know that this person has great education, great qualifications, and could probably teach a master's degree class in public health. So I'm fully supportive of this, and yeah, I have.
Okay,
you have my
any
support.
other legislators?
Thank you.
Anybody from the public? Okay, if the committee is comfortable moving this forward, I'll entertain a motion to approve the budgetary transfer and move the necessary resolution forward.
Second.
All in favor?
Aye.
And I'm opposed. Thank you. Thank you. It's not personal.
It's going to the full.
And it's going to the full.
Yes.
Okay.
It's approved for the
Great.
full.
Thank you.
Thank you.
Thank you.
Thank you. Thanks, Bill. Okay, number 10. I know we have a lot of other business to address tonight, and it's going to take a really long time. Any other business?
No.
Can I have a motion to adjourn?
Motion to adjourn.
All in favor?
Aye.
Aye.
Thank you, everyone. Please, I'm calling to order the Protective Services Committee here, and I've locked down the date. June 10th. Sorry. Wednesday, June 10th. And we're please stand, remove your hats for the Pledge of Allegiance. Commissioner Oster, would you lead us, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, everyone. Take an opportunity while we're sitting down to thank all my colleagues and the employees of the county that are still here with us. Yes, it is an important night in New York. It's an important night in New York sports. But for those of us that are committed to our the people we represent and who are here tonight, thank you. And you should be acknowledged for such. Appreciate it, everybody's patience. First, we have a roll call. I'm sorry, it's item number 2 on our agenda.
Present.
Here.
Present. Thank you, Ed. Item number 3, introduction. We have the introduction from the Bureau of Emergency Services. We have a new deputy commissioner and a new director of emergency management. Commissioner Oster, well, I guess will lead the introductions, if you would, sir.
Thank you, sir. Judging by the time, I'm sure this will be a nice, easy meeting for me, so I appreciate that. We have hired 2 new members to our staff at the Bureau. 2 important positions have been filled. I thought it would be appropriate if we invited them tonight to formally recognize them and introduce them to the legislature. The first one is our new Deputy Commissioner, Drew Knash. Drew Knash is a retired FDNY, career firefighter and fire instructor, and he will be performing the duties of the Deputy Commissioner position. I'm very much looking forward to having his help and support. Much like the Commissioner of the Department of Health referred to, we need to have that continuity within our agency and somebody that can step in when I'm not available or I need additional assistance with stuff. So we welcome Drew to our team. And our other new addition is Matt Nadolny. He's our new Director of Emergency Management. Matt is a police officer by career. He just recently retired from the town of Newburgh Police Department. He has a degree with a concentration in emergency management, and we are very much looking forward to having him support us as well. So I'd like just to formally recognize those guys and thank them for becoming part of our team here in Putnam.
Commissioner, thank you, and welcome, General. And as much as many of us know Drew and his history of service to Putnam County and otherwise, welcome, Matt. Nice to meet you, and we wish you the best and thank you because we collectively very much support the mission of Commissioner Oster, and it's one of the most important functions in the entire county, and the work that you guys do is essential workers, and appreciate in advance everything you'll do to advance the betterment of the BOES. Anything from my committee members?
Welcome aboard.
I'm looking forward to meeting with you and our local fire departments and EMS departments and that continuity of service throughout Putnam County. Thank you. Welcome.
Any welcomes or questions from other legislators? Legislator Crowley?
Congratulations on your retirement in a very tough city. And thank you for everything. Congratulations, Drew. Well deserved. And hopefully now you have what you need to get things done. I'm really excited to see you guys move forward.
I am very pleased as well. Thank you.
Any other legislator?
I'd just like to say the same. Congratulations, welcome, and to you, I'm sure you're thrilled to have a full team.
Welcome.
Legislator Sage?
I'll just reiterate everything else. Thank you. Congratulations on your retirement. We appreciate you bringing your experience, your expertise in your law enforcement and your firefighting careers to Putnam County. I know that people of Putnam County will benefit greatly from your knowledge. So, and thanks for bringing it here. Thank you.
Any other legislators? Anybody from the public?
I would like to, as a Putnam County resident and somebody who works in public health emergency preparedness, congratulations to both of you. I know I said it earlier, but I'm super excited to work with you. And now all the things I've been bugging Jim about, we can hand off. Thank you. Go Knicks.
Thank you. Thank you. And to note, the spirit, do appreciate the spirit of communication. You offering and then bringing the gentleman here to introduce us tonight face to face is a welcome new process. Thank you. Yes. Thank you very much. All right, that was an introduction. Thank you, Commissioner. Up next, item number 4 is Emergency Services. We have approval for Emergency Services Safety Advisory Board appointment, Mr. Bradley. Let's go to item number 4. Okay, so we have in front of us a resume with a submission for Mr. Bradley to be part of the Putnam County Emergency Services Safety Advisory Board. Any thoughts on that, Commissioner?
Yes, sir.
Okay.
So, Mr. Bradley has been appointed to serve the remainder of the term of Eileen Barrett, who passed away unexpectedly and unfortunately. He comes at the recommendation of the chairman and vice chairman of the ESSAB, and we are looking for legislative approval for the appointment.
For the duration of the term?
It'll be for the duration of this term
Just
to
till
end
December.
December of 2026. And it's my understanding that they will seek to have him be reappointed for an additional term after that.
Okay, I've read the resume and the recommendations. Any questions from my colleagues?
No.
No
Thank you.
questions? Any-
Welcome, and thanks for stepping up, and sorry to see Eileen go, and my thoughts are with her family.
Yes.
Any other questions from?
glad to see someone from Kent.
Any
Kent, no, I meant for this tonight, yes.
other legislatures? All right, any member of the public? So we have a motion, I will submit a motion to approve Mr. Barrett for appointment to the Emergency Service Safety Advisory Board. Do I have a second?
That's Mr. Bradley, sir.
Mr. Bradley?
Miss Barrett passed away.
Oh, I'm sorry, I said Ms. Barrett, family name, sorry. So to be clear, I'll make a motion again, for clarified motion, for the acceptance of Mr. Bradley to the Emergency Services Safety Advisory Board. Do I have a second? All in favor?
Aye.
So carried, thank you very much. Item number 5 is approval for Emergency Services Safety Advisory Board reappoints. It was Cuomo, DiMarco, Prentice, and Lewis. Item number 5. And we have all of the resumes attached there. If there is any commentary from the commissioner pertaining to these 5 names.
So these 4 individuals
Four, sorry.
have been on the ESSAB for quite some time now, and they are just seeking reappointment to the same positions that they were in.
And all of these appointments will run through December 31st of 2028.
That is correct.
Okay. One of the, and I think there was validity to it, one of the issues that's been raised by one of my colleagues in the past, and this is on us, is when we have these submissions, there are 4 names in front of us for one approval, and that sometimes can be problematic. And at this late hour, we're not going to divide the question right there, but I will acknowledge what was brought up in the past, and procedurally, I got to get ahead of that. When we have multi-appointments like this, that should be separated.
They don't always have to be. I mean, if a committee member wants you to, they would request it, and then we could divide it. But
Okay.
you don't have to going forward, you don't have to always divide it.
Always
But-
divide the question? Okay. Well, to the question of because it is constructed as 4 under 1 right now, do we have any questions or comments from my committee members about these 4 individuals?
No, just would like to thank them for stepping up. It's a really great, very important committee with wide community outreach, and I like the work that they do. So welcome and thank you, or they've been on already.
Yeah, they've been on already, right, and reappointed. Any other legislators with any, come on, let Chair recognize Legislator Russo.
Thank you. I thank them for stepping up for another term. I was just curious why 4 of them expire at the same time.
So I don't have an answer to that as far as why it's set up that way, where it's obviously a 3-year term. So it must have been a situation where we were lacking in membership and they were all appointed at the same time. So they all expire at the same time.
All right.
Any other questions from any other legislators? Anybody from the public? Okay. There being none, I'll make a motion for approval of Emergency Services Safety Advisory Board reappoints Cuomo, DiMarco, Prentice, and Lewis. Do I have a second?
Second.
All in favor? Aye. So carried. Thank you. Item number 6 on our agenda is approval A budgetary amendment, 26A046, the Sheriff's Office, use of T Commission funds to purchase furniture.
Why don't you stay? I'll be quick. Hopefully.
Welcome,
I should be very careful what I say, right?
welcome, Sheriff Hess.
So this is, we were lucky enough to have DPW assist us in upfitting our conference room, the sheriff's conference room down in the office. We're moving a wall to an old file room. We increased the size, repainted, new TVs, AV system. To go along with that, I'm requesting the money to be transferred for a new conference table and chairs. This is T Commission money, which is, if you're not familiar, inmate percentage of inmate phone calls, inmate tablet use, we get a cut from. So that fund goes down to the sheriff's office. We're hoping to use that to have no fiscal impact for the taxpayer.
Making a lot of phone calls.
There's a lot of phone calls.
They can't keep their cell phones with them?
No, sir. We couldn't collect the T money then.
Don't get arrested.
Thank you for explaining that, because I read that and explaining that. So, any questions or commentary for members of the committee on this budgetary transfer? None? None from the committee? Any other commissioner? Any other legislators? Legislator Sage, recognized by the chair.
I have a question, because I know T Commission funds are supposed to be, if it comes out of the T Commission funds, it's to be used for the benefit.
To the benefit of the inmates.
That's the
Is that correct?
commissary
Oh, the
funds.
commissary
The
funds.
T
Okay.
Commission funds
Oh my
we don't have
gosh.
to use for anything.
Okay.
We try to keep them in-house and use them for the jail. Also, so the jail uses a piece of the sheriff's conference rooms. We share that area. So I was trying to keep that into the jail. So this is
Okay.
how we kind of split that.
Okay,
The
great. Thanks
commission
for,
funds is for the inmates.
I appreciate you clarifying that.
Commissary funds.
Great, great. Thank
Any
you.
other legislators with comments or questions? Anybody from the public on this one? Seeing none, we'll have a motion for approval. Budgetary Amendment 26A046, use of T Commission funds to purchase furniture. Do I have a second?
Second.
All in favor?
Aye.
So approved. Thank you very much.
Have a great night.
You too.
Item, just make sure all the lights are cleared, Sheriff, as we bolt out of here a few minutes after you. Right? Clear those intersections. Next up on our agenda is item number 7, approval budgetary amendment 26A050, emergency services, statewide interoperable communications targeted grant award. Commissioner Oster on the chair, sir.
So I'm pleased to announce that Putnam County has received an award of $3 million under the New York State combined 2024 and 2025 SIG, which is the Statewide Interoperable Communications Targeted Grant Program. That $3 million would be used for the continued build up and build out of our radio communications system. As I'm sure everybody is aware, communications is key to our success in the emergency services world. So we welcome that award for $3 million, and we're requesting that the legislative body approve that and accept that money and allow a budgetary line to be constructed for that.
Do we want that or no?
Well,
Are we going to vote no?
well, we'll see, right? Right, question.
That's wonderful.
Question, sir. With other grants you've spoken of in the past, where the money was already spent, or we were receiving a grant that was to cover costs that we had already paid for. Do you know if that is applicable here? Does it, because we said it was combined 24, 25, 26, right?
This is combined 24 and 25. And no, there has not been any specific designated purchase under this grant.
Oh, okay. All right. So this is incoming additional. Great. Okay. And the funding that we will receive, I'll retract that question. I'm sorry. Any other questions from committee members?
I do have a question. Based on the permissible costs, is this 3 million allocated for what's left in this to buy? What else do we need?
So we're still in the process of completing radio towers, tower infrastructure, which is a very expensive project. Each tower is in and of itself very expensive. But in addition to that, we need other components of our radio system that will allow us to operate more efficiently. For example, bidirectional antennas, which are several $100,000 apiece, can be placed on buildings such as schools and hospitals that allow firefighters and police to operate with radio communications within that building that we might not otherwise have because of the construction of the building interfering with signals.
I guess my question is, do you have a specific plan for this 3 million right now? And just in looking at the list of permissible costs, you know, what strikes me is shelters are a permissible cost. What kind of shelter are they talking about? Are they talking about a community shelter?
No, what they're talking about is a shelter that is actually built at the tower site. It's shelters or houses, all the electronic equipment, computers, radio equipment, things of that nature.
What's LMR? LMR will cost or lease to purchase LMR build-outs, LMR maintenance cost, other LMR related expenses.
So I would have to look into that because I'm not sure.
I can
what
look it up.
LMR is
I just
either.
was
Yeah.
curious, and I really did think shelters meant, oh my God, can we use this for community? But I've been in
repurpose, right?
I've been in the shelters, and they do require a lot. And yeah, if we could, at some point in the future, I guess get a maybe before the full. What's your specific plan for this? I know we need a lot. I know a lot is needed for this. Since I've been on the legislature, I've seen budget allocations for $10 million and $3 million and $5 million. And so I appreciate you telling me what's left in this to build out. I guess I'm curious to know after this long, knowing exactly, what's left with each step of it. I'm just curious, not to hold your feet to the fire. It's a curiosity thing.
Sure. The problem with doing that is that we're kind of tied to using those funds for a specific allocation where they might not be needed in a year's time. For example, some of our our portable radios now are capable of connecting with cell service or satellite service. So that eliminates the need for some other equipment that may have been allocated for in a grant prior to that. So it's constantly changing. The technology changes so much that it would be hard to say what we're going to spend that $3 million on or what our needs will be over the next 3-year to 5-year period.
Great. Thank you.
So, pardon me 1 second, just to supplement, I think what the commissioner is saying here, and I have to make this point because I sat in the back of the room and I heard last year, your predecessor, tell us that the radio project was pretty much complete. And as we spoke about right here, as we've identified at least 2 towers that are in process of construction, the radio project is never complete. Even if everything was built to what we want right now, we're still planning for 5-10 years. So when I sat back there and I ran for this position and I heard that the radio project was mostly complete, not even being privy to the information I am right now, that made me cringe. But so to somewhat look towards your question right there is that, yeah, there was funding and there will be funding. And I think it's better of the legislator to be informed correctly that it's not complete and it won't be complete. It's an ongoing process. Right, right. Especially if we're talking about there's two significant infrastructures that are not done, and there's work going on one right now. That's not complete, which is what unfortunately this body was told last year before you and I were here. Sorry, Chair recognizes Legislator Crowley.
LMR is a land mobile radio. That's what it's referring to. So with this project, that's what it's referring to.
And with that, if I may, through the chair, I do like to know a plan for $3 million. I understand that it's always going to be changing. So
we could put together a plan, but it could be
sorry,
complete.
I didn't hear what Legislator Crowley said.
It wasn't in his
Okay.
fault. I just said it's always going to be evolving because of the technology.
I heard that from the commissioner, and as a legislator, in allocating $3 million, accepting $3 million, that is taxpayer dollars, no matter where it comes from. I don't think it's unreasonable to ask for a plan. We're getting updates on this program, it seems, monthly anyway. So
We just to communicate. So what's in front of us is for approval to receive the funds. What's not being asked of us is how or where it's going to be spent at this particular point, right? So we have an approval in front of us to receive the funds.
and you'll come to us when it's spent.
When-
being spent.
when it's, or planned to be spent, right? Theoretically?
Follow the normal process that we, follow on a regular basis for stuff like that.
Okay,
This is
so
just to receive the money from the state and get it into our county budget.
any other questions from any other legislatures pertaining to this? Any other questions from the public? Can we get up there? Nope, seeing none, I'll submit for approval of Budgetary Amendment 26A050, Statewide Interoperable Communications Targeted Grant Award. Do I have a second?
Second.
All in favor?
Keep beating you.
That's all right.
Aye.
So carried. Next up is our approval, is item number 8, is approval for a grant application, Emergency Services Statewide Interoperable Communications Grant Program. Item number 8. Commissioner, if you would.
So this is a request for approval for us to apply for the state fiscal year 2025 and 26. Also a SIG grant, which is the Statewide Interoperable Communications Grant. For monies that would be allocated to Putnam County in the amount of $895,262. There's no additional matching funds required by the county for that. So we are requesting approval to apply for that grant.
First up, Commissioner, if I may, because the verbiage is right here. Interoperable Communications Grant is what we want to apply for, and I anticipate you getting our support. Being that this is line item right here, any commentary on our current interoperability? You've been efforting great efforts for our ability to communicate with the counties that surround us. Can you throw in a little commentary on that, where we stand, please?
Sure. So we have a significant issue with our departments being able to interact with radio communications to neighboring departments or counties, particularly those on our southern border with Westchester County. The county of Westchester has been adamant about not sharing what they call a system key, which would allow our radio programmers here in Putnam to program their radio channels into our radios so that we could have interoperability and intercommunication between agencies. So the end result would be for our agencies here in Putnam to go to an approved vendor, an approved Westchester County vendor, and at this point they would allow those departments to have one mobile radio, which would be in an apparatus, and one portable radio per apparatus programmed into their system. So it's a consistent concern of ours. It's something that is anti to the entire interoperability program. All this money, millions and millions of dollars, are coming from the state so that we can have communications between agencies. So the fact that we don't have that right now is unacceptable, and that needs to be resolved.
So let's put a name and a face on a situation like that. And this, gentleman, welcome. This is the kind of granular question that you might expect once in a while going forward here. The horrific fire in Mohegan Lake, the double fatality recently, right? We were the second department called, or the third department. Mohegan is a Westchester County department, right? How much did that hinder our response? We had to message back from our departments responding back to you, and then to 40 Control, and then to the IC. I realize as I'm asking that question, if we hadn't prepared, you might not be able to answer that. Maybe you can. Did our inability to communicate with Westchester hinder our response during that fatal fire?
I don't believe it hindered our response. Some departments have taken it upon themselves to go to a vendor and have those interagency channels put into their radios. I'm not sure if that was the case for the responding department that day.
Putnam Valley, I'm sorry, for the purposes of discussion, right? Putnam Valley would have been.
So Putnam Valley does not have that capability of speaking directly to Westchester departments or to 60 Control, which is their similar to our 911 center. So they would have to, in theory, report to our 911 center, and then our 911 center could contact 60 Control. It becomes a big, drawn-out process, and it really puts the safety of the firefighters that are on the ground during those operations in jeopardy.
So thank you, and that's what I want my colleagues to walk away here tonight, understanding that you're efforting that, but we're up against a wall where the communication, just to be able to speak to another department on a radio in basic language, is currently being hindered. But our commissioner here is, to the best of my knowledge, efforting to resolve that. Any other questions or comments from my colleagues on the committee?
No, I'm looking forward to seeing how all this operates together, the 3 million and the 800,000 and. seeing-
Sure. So it's a lot of money dedicated to communications. And for example, the previous grant we spoke of was what's called the targeted grant. So it's very specific to tower infrastructure, radio communication infrastructure. The non-targeted grant can be used for some other items. They kind of complement each other, where you can't use targeted money for certain things, but we can use non-targeted money to accomplish the things that are missing from the other grant.
Thanks for going after these grants. I know it's very tedious work and really helps the county.
Absolutely.
No, okay. Chair recognizes Legislator Crowley.
Just quickly, the Fire Advisory Board last year, I know this came up, and on the July 23rd of 2025, I reached out, and Deputy Commissioner Volk of Westchester reports that we just received agreements this week from law, Putnam County Law, and we're working with Putnam County Bureau of Emergency Response, Commissioner Robert Lipton. Once we receive the signed originals, it still needs to go through our execution process. After that, each agency will need to sign a simple user agreement. Will only be for the agencies that frequently receive reciprocal fire, EMS, and mutual aid. That was last year in July 23rd, and I have that in writing. So I think I just wrote a response now, not to supersede you because I had the original conversation for the Fire Advisory Board.
Anything that gets it
and
done.
I think you guys were there for that, and if we wanted to defer to law, if that's okay for the chair, have you guys heard anything on this since it left your office?
I would have to defer to Anna,
Okay.
and I can get back to you, but not to my knowledge, and obviously it has to be fully executed in writing before we.
Yeah, it was, that was it. It was sent from law at that point, and they had received it and had to have it signed off, and that was July. We're coming on a year now. So,
To your point, thank you, because people are leaving this room here tonight with a much clearer understanding that this is a big problem. Commissioner Oster is efforting it, but it's going to take more than just him to get this done. But it's very important that we get it done because the reverse can be true tonight, right? It could be Croton Falls coming into Southeast. It could be Yorktown coming into the Falls, as happens on a regular basis. And right now, those vehicles are not able to talk to each other. They're relaying through two bureaus who's on the way, who's not on the way, and what they're bringing. So I want everybody in this room to understand how important that is.
would you mind, Chairman, as the Fire Advisory Board liaison, I originally started this as liaison last year to follow up if I sent a memo tomorrow to find out where we are a year later?
Please do, because anything that makes progress on this topic is more important than whose name is on top of it to me. Thank you. Thank you. Appreciate it.
Can I add a comment to that? So it's my understanding that Westchester County has authorized each department that does respond mutual aid to have their radios programmed in limited capacities, one mobile, one portable per apparatus. And I don't see it as a county legal issue to have the fire departments take it upon themselves to deal with Westchester County and their radio system. I think if it was a bureau vehicle or a county-owned vehicle, that would be a different story. But being a home rule state, I think it's up to the fire departments to make the decision as to whether they want to entertain the cost of having that programming done in their radios. So I'm not sure where it falls with legal as far as having the need to have some sort of agreement with Westchester and our local fire departments.
Everything is going to be an IMA. The chair recognizes legal counsel.
Thank you for recognizing me. Yeah, respectfully, anytime you're entering into intermunicipality agreement, there has to be something in writing, just to protect Putnam County.
And they're drafted.
But if just what I believe I just heard the commissioner say is, regardless of us here in Putnam, is that individual departments have been given permission if they choose to pay for it themselves.
Even interdepartmental, we always have a memorandum of understanding. We always have something in writing.
But in that scenario, all of us in this room are not involved.
From the legal department perspective, and being a broken record as a lawyer, but it would be my advice that doesn't take that long. We're here, we'll review it, we'll help you, we'll execute it.
It was done as per the response. Commissioner Volk of Westchester said it was done, and I'm going to repeat it. It says, after that, each agency will need to sign a simple user agreement. So I'm just gonna ask what the holdup is on, and who has signed in to the key.
That simple user agreement, if I may, I think that, no, that's a weird term right there, because Commissioner Oster referred to that before. Was the simple user agreement, as we understand it right now, requires us to go to their vendor to have the keys installed on the radio. So they're using the word simple, but that is a misnomer. If that, no? Chair recognizes legal. No, I was recognizing you.
It's a user agreement is pretty simple. I mean, it's a contract. So I'm not the person who handles all the contracts, although I am a contract lawyer. But I'm speaking for Anna Diaz, who's an excellent contract lawyer. She's extremely efficient. When she gets it, she processes it, she can use it, we send it right back. So all it has to do is be fielded through the law department, and it protects everybody's best interest for us to take a look at it. Like you don't want to enter into any kind of contractual situation without a written document in case something bad happens. You need an indemnification provision, you need insurance provisions, you need, yes, I have not seen this user agreement, but when it's just two signatures, so it's not.
Yeah, I know we started those one point. We sent it to Westchester.
Yeah.
So I'm just forwarding it to you and I'm forwarding it to you.
All right.
Yeah, so I'll then let you guys follow up and you two can talk.
I'm going to call on my own rule here and rein back in the conversation to the approval that's in front of us. I have to say that's the case, but I just hope that everybody leaves this room here tonight putting the full force of all of our talents in Putnam County to ensuring that this becomes a priority, because despite the notion that it shoulda, coulda, woulda been done, it hasn't, and I'm afraid there's a multitude of reasons that it hasn't. I don't think it's a simple fix, and it would take all of the weight of the county in our various functions to move that forward. That being said, I'm going to rein back in our conversation to the approval for the grant application, Emergency Services Statewide Interoperable Communications Grant Program. Do I have a second on that?
Second.
All in favor?
Aye.
So carried. We have approval there. Next up is item number 9, approval grant application, Emergency Services Public Safety Answering Point Operation Grant Program. Item number 9.
So this is also a request to approve us kind of after the fact to apply for this grant. The grant deadline was last week, so we had to get the application in prior to this meeting. What this grant application is a PSAP, or Public Safety Answering Point grant. If approved, the county will receive $248,182 in grant monies with no contribution on the part of the county. And the intended use of that grant monies would be for covering approximately $140,000 worth of dispatcher salaries, and the remainder to be used to cover software purchases and leases and licensing for the 911 center.
Thank you, Commissioner. Yeah, and this seems to be very specific in what it can and cannot be used for as well. But in front of us, we have an grant application approval. So to that extent, do I have any questions or comments from my co-committee members? No?
No.
Any other legislators with a question or comment on this grant? Anybody from the public? No? Okay. That's hearing none. I'll make a motion for approval for grant application, Public Safety Answering Point Operations Grant Program. Do I have a second?
Second.
All in favor?
Aye.
So carried. Item number 10 on our agenda is other business. Do we have any?
Yeah, I have a lot.
Okay.
No, I've a brief bit of good news, unless you don't have it. Okay.
Okay. Chair recognizes Legislator Birmingham.
It'll be brief and it's good news. If you recall, last month or earlier this month, as the legislature, we approved a home rule request to the state legislature to alienate parkland for a tower that was driven up the day after. And I was happy to learn today that both the state Senate and the state assembly have passed that home rule request. and it's going to be sent to it has been, or will be sent to the governor for her signature. So hopefully that helps out with our tower issues as well, communications issues. So that's some good news and some fast action on our part to get the amended.
That would certainly help with the finished project of.
Thank you, Mr. Chairman.
Right,
Thank you.
exactly. Any other business? Other business to report? Okay, I'm moving on to item number 11. Do I have a second? I'll make a motion for adjournment. I need a second, please.
Second.
Second, all in favor?
Aye.
Thank you very much.